Welcome to our discussion with our three of our family, actually, on the subject of mental wellness. Calva Bivens is a licensed social worker. Mikkal Harris, you've just heard him deliver the word to this morning, is a licensed professional counselor. And Dr. Janee Ware Ray is a family medicine physician. Would you welcome them? So we are bringing this discussion to our Sunday morning gathering because it's just that important. And so I want to thank you for having the courage to be here. Not only our panel, but all of you that are here having the courage to be here and to be a part of this discussion. I want to let's get started, right? The first question really, where we start is, what is mental health? What is mental health, mental wellness?
Mental health is your state of emotional, psychological, and social well-being, and it affects how we act, how we think, how we behave. Mental health is something that's complex and real, and we need to look after our mental health the way we do our physical health. And it's so important that we just take the time to acknowledge how we're feeling, how we're doing. Mental health is very important.
Anybody else on the panel want to add anything to that? Yeah. Okay. All right. So mental health is mental wellness is this state that you just described for us. So why are we talking about mental health here? Why are we even having this discussion?
We are having this discussion because there is such a huge stigma for people who are suffering from mental health. You know, people who are suffering are accused of being weak. They're accused of not having a relationship with Jesus. There's so much misunderstanding and misinformation. So we are talking about this because it's something that needs to be talked about. We need to know the facts about mental health. We need to know how to address it and what can be done.
Okay. Anybody else want to add anything on our panel?
I agree. There is a stigma attached with patients who suffer from mental health disorders, whether it be depression.
Would you hold your mic up?
Oh, I'm not. Okay. I think there's a stigma that needs to be addressed, and we need to debunk, those myths in regards to mental health so people can seek help.
Why? What? I guess my question would be, what is a stigma, and why is there one? I keep hearing that there's this stigma associated with getting help that prevents people not only in Black and brown communities, but in church community from getting help that they need. What is the stigma, and why does it even exist?
In our community, especially the Black and brown community, we have been taught not to talk about certain things, not to address certain things, to just let it slide, don't pay attention to it. And the stigma is really just about the misinformation and not wanting to discuss or acknowledge our mental health or the things that might happen to affect our mental health. And so we address that stigma by talking about it, by having workshops, by attending workshops and getting the facts about stress and anxiety and depression and any other mental illness. But we start by just addressing the stigma. We start by just addressing mental health and talking about it, getting the discussion going.
Okay.
Well, I mean, the stigma also, I agree, a lot of it is the is a lack of information. But one thing is people don't get help because some people actually don't think they need help. Like I found that to be true too, that sometimes people don't know that they actually need help. A lot of us, we know what we want, but we don't necessarily know what we need. Or we know what we want, but we don't know how to get it. And I think it's people being able to see that the fires in their life are a symptom. Because sometimes we equate mental health symptoms with like, always I'm feeling bad. Or I'm uneasy, or I have anxiety. But some things is people who can't maintain relationships, or so it's giving people information so that they know to seek help.
Thank you. So we're having this discussion here in our church service this morning as a part of our church service, and that's very intentional. And I hope I'm succeeding at this intentionality, and that is because I think that the two have to be we have to see the connection between our spiritual health and our mental health. And so that brings me to the question of what is that connection? What is the connection between mental wellness and spiritual wellness?
One thing I want to just mention is that research has shown that people who have a genuine relationship with Jesus Christ, people who are actively involved in church, Bible study, church attendance, reading your Bible, whatever it may be, those people who have a genuine relationship, they have fewer stress-related symptoms. Their immune system is stronger. They recover from illnesses better. So there is a very strong relationship with our connection with Jesus Christ, and then how we handle our mental health.
So I don't know if anybody wants to add anything, but I don't want to be a bad host and do
No, but it's definitely a connection because God made us. I mean, simply put, God made us, and he formatted us a certain way. And he formatted us so that when things go wrong in your body, your soul is going to be triggered. When things go wrong in your soul, your body is going to be triggered. And the reason why I know that there's a relationship between that is because people, in my field, there are people who get stomach aches it's not related to physical illness at all. It's because something happened to them in the past, like post-traumatic stress disorder. Like the place of the soul is where all your memories are. That's where your facts are. And when you remember all this stuff, there are certain symptoms that come with PTSD that will prove that because you got traumatized, the other parts of your body will start to react to that trauma. Even if you are unaware of it, even if you tried to forget about it, if something in the natural world reminds you of something that happened to you, you're automatically triggered. And if somebody cuts you open, they would never be able to determine where it is because it's not actually in your stomach. It's in the part that God created you that he's trying to save. It's the part of you that he's trying to transform. So when God speaks about transforming people, he's trying to transform you because he wants you to be able to have access. And I know this sounds cosmic. You need to have access to the surgery in the Holy Spirit that he can actually do with you. There are certain things that a pill can't do for you. When I was suffering from mental illness, they did give me a psychotropic medication, right? But my stubborn self said I didn't want to take it because I didn't want to know that the medicine fixed me and not God. Now, I'm not telling y'all to throw y'all pills out if you on your medication. That's not my implication. But my thing is, there is a when people say brain-body connection, there's also a spirit-brain-body connection that people leave out. That's why there's also statistics that says that people who go to church and they really have a relationship with God, when they go to therapy, they heal faster. Like you'll see statistics like that because doctors will help you heal from the outside in, I don't mean like they heal you on the inside of your body, but God will heal you from the inside out. So there's some things God can fix that a doctor can't, and there's some things a doctor can fix that God can't. Or God won't. Let me say it that way.
Dr. Ware.
I guess I'm.
Should I call you Ware?
Then I heard a couple of things. Where I go by Ware professionally.
Okay, so Dr. Ware, you want to respond to that?
Yeah, so I heard Mikkal touch on a couple of things, and there is a such thing as they term it psychosomatic symptoms, where patients manifest symptoms physically, but it's related to their overall mental health. So that is a true phenomenon, and typically we spend lots of hours and times, trying to work those things out. I guess the most common one is chest pain. Patients can present with chest pain, palpitations. We can do all types of studies, EKG, blood work, and it's non-revealing. But then underlying that, after all that workup, it does manifest as something that needs to be treated along the mental health spectrum. So that is definitely a fact.
Okay.
Medicine?
Yeah, the medicines. Oh, yeah. Typically, I do typically see a lot of patients, and I have recurrent visits because I'm a family physician. So I see patients on a continual basis. So sometimes I'm working with certain illnesses and diseases, and then I know that the depression or the anxiety is there underlying. So definitely based upon me, developing those relationships, I feel more comfortable introducing the topic. So I'll start off because typically people don't want, the term of having a mental illness, whether it's depression, anxiety. They don't want the diagnosis. So typically I'll start off with saying, hey, if you could just talk to somebody, because I think this is manifesting and, affecting your overall health, whether it's taking your medications, whether it's coming to visits. I'll kind of introduce it that way, just to get the ball rolling. But I do, after time, especially if I get them established with one of our therapists, then I do, talk to them about, I gradually kind of introduce it like, hey, medications may also be an option in addition to this, because I try to destigmatize it as well, because I'm like, this is going to help you be well overall, physically, and mentally. So I'm constantly trying to, debunk the stigma that's associated with mental health disorders. And just trying to encourage patients to seek treatment, and that sometimes even therapy is not enough. We do have to sometimes take that next step and introduce medications.
So how, that answer took me off my list, my schedule, but that's okay. Because I want to ask, how then do you, not just you, but your field, how do medical doctors then make the determination when something is I hope my terminology is right. When something is a medical issue versus a behavioral issue, I guess would be my.
I think sometimes they can overlap. I think even in Mikkal's sermon, he was talking about somebody who's sick for this prolonged period of time, had this chronic disorder. So I think that sometimes, like even in chronic pain, some of those things can kind of overlap. So I usually introduce them in conjunction. So I'll say, like, example, for a patient who's chronically in pain, needing pain medication, seeking treatment on a frequent basis. So I'll say, hey, I'll try to put myself in their shoes, like, hey, I know this has been affecting you in so many different ways. It may have family effects, it may have day-to-day effects, they may not be able to work. So I'll go in and introduce it on the backside. Like, I know, how is this affecting you, like, mentally? So that's how I'll try to introduce that topic in terms of how, patients may need to be, think of other alternatives in terms of chronic issues and mental health issues.
So I heard, back to Mikkal here, I heard a statistic yesterday, and I think Calva and Mikkal mentioned this, about the relationship between people of faith and their ability to heal or recover quicker from depression and those kind of things. I heard a statistic yesterday from another healthcare professional who said that in the last 5 years, that 70% of all professing Christians have suffered or are suffering from depression. Can you respond to that? Why is that, if that is true?
Well, first of all, I would be interested in knowing the study. So, because that's kind of high. I also think what happens with just mankind and social media and statistics, I do think that the danger of mental health awareness is people think that they're mentally unwell.
Okay,
Like,
okay,
like, like people have to be able to distinguish between when they're sad and when they're depressed. Just because you're sad doesn't mean you're mentally unwell. You're just sad. Or if you're having difficulty in your life, like if some if stress and pressure is on you right now, you're not necessarily mentally ill. You need to get that assignment done at work that you've been procrastinating to do. Meaning that there are some things that people may associate with having a mental health issue that can be solved by a corresponding action if they were better at something. Me and my wife was talking about intentional organization this morning. And if I'm more intentional about how I organize, I don't feel as stressed every day because I'm not doing everything at the last minute. So the danger of making people aware of stuff is kind of like a hypochondriasis, you know something is an issue now, so you think you have that issue because everybody else is saying they have it. So I would be interested in that statistic because the Bible itself doesn't teach that your life is going to be free of trouble. It doesn't say it's going to be free of sadness. It doesn't even say it's going to be free of anxiety. So there is a normal amount of anxiety a person will have in their life. There's a normal amount of sadness. There's a normal amount of trouble. And until it starts to interfere with relationships and keeping a job and doing the things you're supposed to be doing, you're not mentally ill. You may just need to reorganize your life. So that may contribute to it. But without me seeing the study, I wouldn't really know how to speak competently to that.
But Pastor, I do want to share some statistics with you guys, just a few. So 1 in 5 American adults experience a mental health condition in any given year, 1 in 5. And then 1 in 6 young people will experience a major depressive episode in any given year. Right now, 57.8 million people have a mental illness, and almost 20% of adults experience a mental health issue. But one thing we need to understand is that our mental health can change. It can go up or down, depending on how we're handling stress, depending on what we're doing. And again, our mental health has to be attended to, just like we attend to our physical health. You know, it's about us taking time to see, why am I feeling sad? What's going on? Do I need more rest? Do I need to eat right? Do I need to stop with all the junk food? So there are things that we can do to make sure that we are addressing and taking care of our mental health.
So then it sounds like you're saying that mental health, all of it actually, mental health, mental wellness is this broad umbrella that doesn't necessarily mean somebody has a psychotic issue.
Correct.
It's a
Correct.
broad
Mhm.
issue of health
Mhm.
and not just a broad issue of wellness and not just that there's a limited to some psychotic episode. Is that, am I getting that? Am I saying that right?
Yes, yes.
So is depression, stress, confusion, whatever, all of these things are under the broad term of mental wellness. Is that?
Yes, we all have mental health, and we all experience stress. We all experience times when we are depressed, and that's normal. It doesn't mean that you need to go and be locked up or whatever. It's just an everyday thing that we all experience. And again, I can't stress it enough that we have to pay attention and look after our mental health like we would anything else. If you have high blood pressure, you know that you have to eat right. You know that you may have to take medicine. The same thing with your mental health. Look after it. Pay attention to how you're feeling. Make sure you get enough rest. Make sure you're exercising. Make sure you're eating right. all these things.
Anybody want to add anything to that?
I think sometimes, well, in terms of diagnosis of depression, because I know we're talking about that, and we also alluded to, that everybody goes through these spells where they have, depressed mood or increased mood, and it can be related to any different factors that are in our life. According to the DSM-5, there is a strict, criteria that you have to meet even to be diagnosed with depression. So there's a time frame, for continuance of symptoms. And there are also different symptoms that have to manifest, a number of different symptoms that have to manifest within that given time in order to even, attain the diagnosis. So we have to keep that in mind too.
That's what I was about to say. And the same thing is with post-traumatic stress disorder, anxiety disorder. It's a certain amount of days. This stuff have to happen. So there is a criteria. That's what I mean. When people did the survey, they don't understand all of that. So they might loosely just say, hey, my wife made me mad and I ain't go home for a week. You're not mentally ill. You're stupid. You need to go have a conversation with your wife. You're not really actually mentally ill. So that's what I was saying. There are actually strict criteria to make those determinations, and good doctors and good therapists will actually abide by that criteria, because the people also need to be aware it is a way for people to get legal drugs to prescribe to them that they want to take. Because I have clients who do it, and they just want to get the legal drugs you give them because they benefit from the drugs. They don't have an illness.
That's interesting. You were going to say something, Doctor?
Well,
Because they mentioned drugs. I want to give you a chance.
I can address a little bit of that, but there are different drugs, specifically when that comes up. I specifically think of benzodiazepines that are highly addictive, and that I truly try, if at all possible, not to prescribe those drugs, because there's so many other drugs that are available to treat symptoms. But I do commonly see that where people are given medications just to kind of keep them at bay, or
Okay.
especially and then I always also recommend, if patients have anxiety, depression, I'm always recommending, hey, a medication in itself is just not the end all be all. You do need to seek therapy services outside of this. So I'm really big on them both going together. If you need medications, then I think at some point you do need to be talking to somebody just to kind of follow up and see how you're doing.
While you're on that, are there medications for physical issues that can affect a person's mental well-being? Are there I guess more directly, are there medications, physical medications that have a mental or psychological side effect?
With any medication, you're going to have some given side effect, whether it's stomach upset, it may be cleared through the kidneys. You may have some decreased kidney function associated with it. So any medication that you could potentially take can have some different general effect in terms of your mood.
Oh, okay. So here's a question. Before we go to questions from the audience here. What is the difference? How do you know the difference between a mental health issue and a discipleship issue?
So
Did it, was it clear?
it is clear. Do you
Okay.
have another way to say it besides discipleship, though?
I'm trying to.
Are you saying a mental health issue and a spiritual issue?
Yeah. So how do you know? I'm trying to find another way to say it besides discipleship. How do you know, especially when we go back to the statistic I heard yesterday about 70% of believers being depressed? How do you know when something is a real mental issue, mental health issue, and when something is just that a person is not obedient and not reading the scripture and not in prayer and not in community and all those things that believers are supposed to do? How do you know as a professional the difference if the symptoms manifest the same?
So I don't know if it's even something that I think about.
Okay.
Because, you know, when people come to you for help, they just come to you for help. So sometimes you're not able, they may not have divulged that much information for you to even know how they're living for God. Number two, everybody lives for God at a different level. So, you got them, man. It don't take all that, people. You know what I mean? So it depends on how the person lives. But one thing I would probably make the determination about is when psychotic symptoms are involved, like when people are hearing voices, when it's things that people can't control with consciously how they think, like certain things that, cognitive impairments, or people who hear voices, or people who have intrusive thoughts to the extent that these thoughts are intrusive, that it pushes them to do certain things. Like I would say things that are connected. When I get a patient who has real psychosis or things like that, the last thing I check is a spiritual problem, because usually it's going to be substance induced, or some underlying disorder. It's kind of like for me, because I dealt with all my experience for the first 5 or 6 years was all schizophrenics, schizoaffective disorder, people who are very impaired. So it's what you call affect. So if I look at your affect and it's blunted, or it's flat, or it's constricted, to me, that's when I start knowing that it's a person who may have some underlying issue that has absolutely nothing to do with God. Because when you look at them, you can tell, this is the best way I can explain it, that's not clinical. You can tell that person is not there. They don't really express a lot of emotion, not a lot of sadness, or they express one emotion so high that it's uncontrollable. Also, religiosity, I used to see that a lot. People who were so over the top about God, these type of delusions about God. So if you're trained to do it, when that person sits in front of you, it's more of a feel for the work, and you could see it more than I can tell you definitively, because there are people who are discipled very well, but they are seriously mentally ill. So it just depends on how severe that person's disorder is, that determines whether discipleship will work or not. Because some people can be so far gone that when they go see her, she's definitely giving them the strongest meds that they need. Like they can't maintain a baseline reasonable enough to be discipled because the disorder is too great.
Oh, yes. So what Mikkal is talking about is more like schizophrenia, schizoaffective. Those are people who have psychotic symptoms, and those definitely have to be managed with medications. Those definitely have to be managed with medications. We typically can't, talk those symptoms away. Families, they need a lot of social support. They need follow-up just to make sure that medications aren't having different side effects. But key for them is just coming in routinely and staying on their medications. So for some disorders, you definitely have to be medicated.
Thank you. We got a few questions from the audience here. Oh, okay. All right. Is there, and this will be for the whole group, for the whole panel. Is there a difference between demonic evil and mental illness? That may be for a part 2, but I know that one's deep, but I got to give it.
Oh, when I was telling y'all about devils getting cast out of me, if it was demonic evil, they would have been gone, because devils got casted out. Like there are certain things, and there are certain things that Christians like to relate that something is demonic. Okay, so if it is demonic, your spiritual life fixes it. You get me? So I'm gonna use Vincent's example because he looked at me. So if Vince is having a demonic issue that's messing his relationship up with his wife, then the counseling he gets from his pastor, the prayers that he's saying, when he comes to me and I cast that devils out of him, that actually might be fixed. Like we can get rid of the devil. However, what happens in spiritual things is the Bible says that when you cast the devil out of someone, if that person doesn't have a pattern of behavior or a pattern of thinking that can prevent the devil from coming back in, then that one demon brings back 7 stronger than the one that you casted out. So the issue is, even if you wanted to deal with stuff on a spiritual level, if I cast the devil out of Vince, but there's a pattern of behavior that he has, then I have to help him fix that pattern of behavior, or the devil comes back. That's what the Bible says, that when Christ left getting tempted, the Bible says that the devil came back at an opportune time.
Right.
But since he was Christ, he wasn't going to get a foothold. But Vince, if he doesn't fix the pattern of behavior, he becomes subject to the demonic activity only because he keeps making himself available to the demonic activity. So there's this back and forth, this interplay, just like in the Bible when they casted all the devils out and he was like, man, I have a legion, whatever. I just imagine every time I read it, that's what he sounds like, the Exorcist or something. I have a legion, whatever. He said his name. However, you don't hear anything else about that man in the Bible.
That's right. Right.
But it's a possibility the legion came back. You just never hear about him again. He left, he was feeling good, and Christians all over America who come up and they get devils cast out of them and people pray for them, they go home with the same pattern of behavior. So it's demonic in the sense that if you give the devil a foothold, it becomes a demonic disorder because you keep allowing him to use you to do what you're doing. The Bible says that we are not ignorant to Satan's devices, but people that are, they become used by him because they don't know how to keep them off.
But is mental illness demonic? I guess is the root of the question.
No, I don't think it is. It wouldn't be any more demonic than the person who was born with a heart condition or diabetes, or no, I don't think it's necessarily demonic. I think you got a doctor sitting here. Some of it is on a biological level. Some of it is biology. All of it isn't psychology. I mean, biology affects psychology. So if we just try to say it's demonic, then we will have to say kids who were born with certain type of deficits, that's demonic in itself too, which I don't think that would be true. I just think we try to apply principles to mental illness that we would never apply to a physical illness. So you wouldn't say a person with diabetes is being controlled by the devil. You would only say that for a person that you said had a mental disorder.
Yeah, in most cases it's a chemical imbalance. So that's why we treat with medications to treat the chemical imbalance. So I don't want people to think that people with schizophrenia who are hearing voices or seeing things are demonic. These are more likely brain imbalances that need to be treated with medications.
Thank you. Thank you. All right, just a couple more. I won't ask any more. I won't ask any more of mine. I'll come to the. Oh, okay. Let me see if I can read this correctly. Can we hear from each of you just a little bit more about experiences with mental health, how it impacted you, and what steps you must take to overcome difficulties? And I think the last part of it you may have answered. And will problems appear later? Let me read it again. It's a long, multi-part question. Yeah. Can you talk about experiences with mental health, how it impacted you? So your experiences with mental health, how it impacted you, what steps can be taken to overcome those difficulties, and will the problems reappear?
I guess I'll start off because I'm not going to be able to stay on track with it. Okay, I would say my experiences with behavioral health, it just made me more sensitive to, patients' needs, and then how I can, help and facilitate their needs with the things and the resources that I have around me. I think the big thing is that just knowing that patients sometimes need, there are different levels of support that patients will need. when I'm seeing them and they have a diagnosis or there's a potential diagnosis. And I think the more we educate, people in general about mental health and and remove the stigma, I think people will get the help that they need. The problem is that we're just not addressing, I don't think doing a good job at addressing the stigma and allowing people to be free and receiving treatment.
One of the reasons why it was so important to me that I pursue a master's in social work is that when I did groups with women, I met a young woman once who her baby had been shot by her 2-year-old. And the trauma that she experienced from all of that and not having anyone that looked like me to be able to go to and talk to her about that trauma, that deep hurt and wound. I remember just how, of course she was blamed, it's your fault and all of that. And just how important it is that we are able to sit down and talk about the traumas, the things that hurt us, that affect us, and to know that there is help, that we can seek help for the things that are, the trauma that we all can experience at one time or another.
And I wanted to deal with the part of that question that said, will it return?
Mhm.
Because that's what I heard. Sounds like
Yeah.
a concern of that. So one thing I learned just from going through it myself, and I got my wife sitting there, I got my mother sitting there, is that sometimes things do come back. Because like I said in the message, it's you can't undo trauma. Only thing you can do is rewrite the story. So every time you get anxiety or you get that fear or you get that depression, it's your opportunity to rewrite the story. You determine the end of the story. Somebody determined the beginning of your story, but you're always empowered to rewrite the end of your story, because ultimately, when you deal with mental illness, I'm talking about in the sense that it's trauma, like we're talking about. It's not on the biological level. The stuff will come back because it's part of you. Okay. And like the church I used to go, he used to say, a problem unlearned is a problem returned. But one thing I realized about that is that when my anxiety comes back, it's not a problem for me. I beat it one time, I'm gonna beat it the second time. I realized the reason why I have it. Once I realize the root of it, I can take the power from the fruit of it. Do y'all understand what I'm saying? So symptoms only have control over you when you feel like they're bigger than you. That's why when the Bible says, and I'm not trying to make it spiritual, but this is how I got it. When it says magnify the Lord, you have to make God bigger than your problem. Because sometimes if you just focus on that problem gets bigger and bigger and bigger and bigger and bigger and bigger. And you have to learn as a believer how to prioritize your thinking. Let me say that I had to learn that everything I think was not from me. Because we'll sit here and say we believe. I mean, people believe in demons, if you believe in them, right? If you actually believe in the spirit realm, you can't possibly believe that everything you think is from you. And I've learned to distinguish between the two. So when you have these symptoms and stuff, you have to really, I get in a place where I just trust God. I tell my wife, okay, I felt some anxiety today. She always go, what you do? I just kept doing what I was doing, and it goes away. So what happens is you get more and more and more mentally unwell when the only reason why people have panic attacks because they fear another attack. They fear having another attack, and they get so severe till you start having panic attacks. So I would say that if you have mental health symptoms and you've beat them, I would anticipate that they would come back. And don't feel weak, like you're not spiritual. Now, if you ain't spiritual, you need to do something about it. But if you know you're doing all the things that you need to do, then just keep going. Go get professional help if you need it. If you need medication, go get it. But I don't think that you should a lot of times Christians don't understand that our walk is mountaintop to valley, valley to mountaintop, mountaintop to valley. We don't have a mountaintop to mountaintop to mountaintop Christianity. And if you're living that type of Christianity, you're not a Christian. I promise you that. So that's what I would say about that.
Last couple of questions. We're gonna wrap up. Medication, and anybody can answer, but this is specifically for you, Dr. Ware. So this person is concerned about the side effects of certain what they describe as mind-altering drugs, and I think is the term. I don't know. Certain mind-altering drugs. How do you know what's okay and what's not?
Well, typically, if we start patients on a medication, and different classes of medications have different side effects. So the one that we most typically prescribe are SSRIs. Those medications do come with side effects, and typically when we're starting a medication, we do let the patient know of the typical side effects associated with the medications. And what we do is monitor them over, like a 2 to 4 week period, because that's when they will usually have most of their symptoms. And then based upon that, we bring them back in, we assess for, symptoms associated with medication versus how for in this example, how their depression is doing. And then we determine whether or not to continue the medication. But specifically for like that medication, that class, typically stomach GI symptoms are the most common, nausea, stomach upset, those types of things are most common with those medications. But it differs from medication class to medication class in terms of what symptoms you might exhibit.
So if I go to a doctor and they want to give me those kinds of medications, mind-altering type medications, and they're not as diligent or as caring as you, they're just writing a script. When should I say, what are the things I hear that should say to me, I need to talk to somebody else before I really start taking this?
I think if you're really concerned about your symptoms, I think you should definitely call in and check with the nurse and see if those are, symptoms that are typically associated with the medication.
Okay.
Sometimes anxiety about taking medications in itself can produce, more symptoms. And so I think definitely looking the medication up, and I talk to patients about looking medical things up in general on the internet. I think if you find like a viable source that you can research information about medication. So I've typically had to tell a patient, like over the past 2 weeks, I think she was having some symptoms and she went and just did a blind search on Google. So what I found helpful was to give patients resources for like, okay, if you're going to look up this information in the in-between time, this is a viable resource for,
Okay.
looking up information. So
Not
I
just
think
anybody else.
right. Yeah.
Okay.
Don't do a blind search about medications, symptoms, because it'll always bring you to like the worst case scenario. And of course, with that, you have more anxiety feeding on that. And then you may have symptoms that are not necessarily a manifestation of the medication. It may be just anxiety about, just uncertainty.
She is not lying. I've had every disease known to mankind on Google, man. It's like every time you got a cough, or it's certain things that everybody has that it's just related to any disease that you can have. So I want to echo that with her, because y'all, I was the Google what's wrong with me king. And I realized, my God, you're going to be dead in 24 hours. The stuff I'm looking up. So, please get a professional like her to tell you what's wrong, because I'm telling you, I done had everything from swine flu to the blue blinding pig, man. I'm telling you.
Yeah. And I guess the other thing is, like, when you do that and when you look things up, then you start to look for symptoms that you may not even, have. So
right. You swear you look in the mirror and you're like, my eye twitch,
Because you stared too hard. Are there some strategies? Our final minutes will wrap this up, I think. Are there some strategies that can be used for your mental health that are non medication? Are there some strategies you can employ for your mental health that don't involve taking medication?
And I think Calva alluded to some of them, exercising, making sure you're getting adequate rest, you're eating right, because some of those things can kind of snowball in itself. Like if you're not sleeping well, that could be an underlying diagnosis in itself. So I think like letting your physician know if you're not getting adequate sleep. Some of our watches, can monitor our sleep patterns and monitor how much actual sleep we're getting per night. Because if you're not getting adequate sleep, then that can manifest as, I'm tired, I have headaches, but it could also be I have sleep apnea that needs to be diagnosed. So I think following up with a physician, regularly checking in as far as that's concerned. We talked about exercise, meditation. We should be doing that and just kind of reflecting on our days. I think Mikkal he commented on
Legion.
I think he commented on just checking in just with your mental health. He did comment on that. So all those things kind of interplay on each other. And if you're unwell from that standpoint, it's going to snowball and have other effects on your mood, whether or not you have anxiety, depression, those things can affect you as well. Stress from your job. There are just so many things. I don't know.
Okay, we are not going to finish all of these.
I got one for you. Well, first of all, you can start hanging out with the right people. I know that's simple, but you'll be surprised how much of your stress is connected to people. I promise you. That's one thing. Another alternative, when I was going through it, I went to a chiropractor. And I was sitting next to a chiropractor. And she happened to be a believer. I promise you, when this lady moved, y'all, I cried like a baby as a grown man, because she helped me through this season of my life. And she took me in there, and my C1 and my C2, the base of my skull was pressing down on those two vertebrae. And I went through whatever the care plan was. I did it for 12 weeks. She actually gave me a workout called a surge workout. I worked out with her every day, 5 days a week at about between 5 and 5:30 in the morning in Orland Park. And she gave me an adjustment every time I did it. And I promise y'all, those symptoms went away. So that's another biological thing that people aren't aware of, because the C1 and C2 is responsible for mental illness, anxiety, emotions, and stuff like that. And it gave me an amount of relief. And also what she did was we had conversations about how to organize your life and all of that. So I would say there's, like she said, you have to plan your life so you can optimize success and give yourself time to actually evaluate your mental health. We don't evaluate our mental health. Even people who work out every day, they don't necessarily have any. Do any of you have any mental exercises? See, that's what I mean. We don't have mental exercises. We don't have some of those mental exercises can be prayer, can be studying, things that will get your mind off of that stuff that will help you keep your mental health at the level you need. She said maintenance. I heard her say that. You got to pay attention to how many people y'all have cars, and I know me, I'm not good with cars. I'm driving to Bourbonnais. All of a sudden, my gas light come on. I'm like, oh my God, you got 3 miles left. And the exit 5 miles away. I'm in there praying. So you can't treat your mental health like that because you'll run out of gas. Seriously, that's what happened to me in my life. Yeah.
Any final thoughts from each of you?
First of all, I just want to thank everyone for taking the time out to listen to us. I just want to thank the panel. Just my final thought is just take care of your mental health the way you do your physical health. Pay attention to how you're feeling. Pay attention to your emotions and be ready to address them, to be ready to do what you need to do to take care of yourself.